Seattle and the Seattle region is ground zero in many ways, because we've seen, as of last evening, 45 diagnosed cases of coronavirus in the Seattle area, not in the Seattle city, but mostly in the Kirkland area, which is near Seattle. And we've had 10 fatalities because of that. And 8 of those deaths have happened, unfortunately, in one senior nursing facility. And so it does highlight the vulnerability, especially that is faced by the elderly community members and those who have weakened immune systems to begin with. And it's good that Governor Inslee has declared a state of emergency. And in fact, today at 1 p.m. Pacific time, the City Council will be meeting to vote on a proclamation that Seattle's Mayor Jenny Durkan has written in order to have emergency powers invoked in Seattle area in order to contain the virus and deal with it. And it's important that these steps are taken, but I will tell you honestly, if you talk to ordinary people here, there's a certain emergency proclamation fatigue that they will tell you about, because we've seen such emergency proclamations being declared on other issues, emergency issues like homelessness, which are related to the overall dysfunctionalities of the capitalist system, and really nothing being done to follow up on it, not surprisingly, because this is mostly status quo corporate politicians who are trying to look like they're doing something, but there are very few follow-up steps. And so I really agree with many of the immediate steps that have been outlined by your other guests about ensuring that co-pays are eliminated for people to get testing and also whatever medical care they need. And in fact, several days ago, I sent a letter to the mayor and to the King County executive saying that they should absolutely do that immediately. And also the issue of flexible work hours and enough paid sick leave. And look, the reality is that even though the union movement has valiantly fought for and won paid sick leave both in Seattle and in Washington state, most workers who need this leave and who are probably the most vulnerable to such cases are the lowest paid workers, and they don't dare stay at home because they feel like they need to go to work. 45% of Americans don't have even a single dollar in savings. And so we absolutely need to take these emergency steps, but it does bring up the question that looms large, as Dr. Woolhandler is saying, about the urgent need for Medicare for all. And we need to have these stopgap measures, but it really needs to have a serious conversation about Medicare for all, and really the need to fight for Bernie Sanders' campaign, because Joe Biden represents the same status quo that is not going to allow us to have this, because the billionaire class is absolutely opposed to it. But I would really also urge the political officials to think about the workers who are not going to be able to stay home and work. And in fact, so it's important that the question of delivery drivers, rideshare drivers, the airport workers, as your other guest was talking about, port workers, public transit workers, custodial workers, hotel workers, many of them are going to be on the front lines of potential exposure, and many of them are very vulnerable workers, many of them immigrants, with people of color, women, who are not going to dare take time off because they are, hanging by
definition, they're service workers and they have to be at work. Also, being paid to work at home is different from sick leave.